Hey, Godfather of Anxiety here. I just wanted to make a short video about nervous system hypersensitivity and health anxiety and how one kind of feeds into the other and leads to the other. I've told you guys in my other videos, I actually made another video a long time ago now, almost 4 months, about health anxiety. And this is something I've struggled with various times over the last 21 years. But this nervous system hypersensitivity, I believe, is what often leads people with anxiety disorder to develop health anxiety. And I'll explain what I mean here. First of all, hypersensitivity as it relates to your nervous system. If you look this up, you look for the definition on the internet, you're going to get something about, you're going to be scared of loud sounds. You're going to be hyper aware of everything, right? So your loud sounds are going to trigger you. Bright light might trigger you. Any type of stimuli, you're going to feel it in an exaggerated way. And this is because of the fight or flight chemicals that are being dumped, right? So, so you have this hypersensitive nervous system that almost everyone with generalized anxiety disorder or panic disorder and many of the anxiety spectrum conditions has this, PTSD. That's another one where, loud sounds can trigger people. So that's what you'll see as a definition on the internet about nervous system hypersensitivity. But having suffered from this, extensively, I can tell you that it involves more than loud sounds and external stimuli, even internal stimuli, normal things, gastric functions, breathing, things like this are affected, and you are noticing things that you wouldn't normally notice. And what can happen, and what happened in my case, is if you have some external physiological health problems that are not serious or life-threatening, but have real symptoms, and your nervous system is already hypersensitive, it can really take you to a bad place when it comes to health anxiety. So what happened to me was when I was about 31, that's when I had my first panic attack. And I didn't know this at the time, but I had recently developed a lot of allergies. I knew something was affecting my breathing. I went up to the emergency room one time because I had some wheezing in my chest that I'd never had before. They checked it out. They said everything looked good. That was before I even had a panic attack. But that was just a physiological sign that I was getting these allergies. So anyways, then when I started having panic attacks, the summer of 2003, I had that same shortness of breath, but it was worse. And I also was very dizzy. And again, upon examination, almost a year and a half later, I had some inner ear dysfunction, again, as a result of the allergies that had come on. I went to see an allergist, and I think a lot of you guys probably know that for whatever reason, when your body starts seeing your environment as a poison or as toxins, that's when it builds up the defenses that cause the immune response. And I was allergic to everything. I was allergic to trees, grass, cats, dogs, just you name it. The one for the cats was still on my arm when they did the prick test like 3 weeks later. She said it was the biggest grass pollen circle she'd ever seen. So that was a real physiological thing that happened. And it's not that unusual for people to develop allergies as they, go on through their lives. But if you already have a hypersensitive nervous system, then everything, all those symptoms are going to be exaggerated. The dizziness is going to be really noticeable. I remember, and I've mentioned this before on the channel, sitting in a room and just watching the ceiling spin, or sitting in a dark room in front of a television and watching things move on the screen, even though nothing was moving on the screen. The dizziness was really bad. And, I had that. I also had the shortness of breath, as I mentioned, and that was bad. I had a feeling of breathlessness a lot. And, you guys understand that if you feel like you can't breathe, that's about as scary as it gets, right? I mean, if you've ever had someone hold your head underwater or hold a pillowcase over you when you're a kid, teasing you or messing around, it's not fun at all. And that is kind of the feeling that you get if you already had, like in my case, I already had allergies that were triggering real symptoms, but because of a hypersensitive nervous system and my stress level at the time and the fight or flight being activated, I was feeling them, exponentially, the symptoms were exponentially worse. And I'm just going to give you guys a short list of the symptoms that I experienced, the physical symptoms, some of the physical symptoms I experienced during this time. And again, clearly my nervous system was in an excited state, a hypersensitive state. But I already mentioned shortness of breath and extreme dizziness, heartburn on steroids. So I had already been diagnosed again earlier with gastroesophageal reflux disease, right? GERD. Not a life-threatening condition. It can be unpleasant. But again, with my nervous system, hypersensitive, and the fight or flight turned on, your stomach's producing more acid. And it was unbelievably bad. The heartburn I had, I wouldn't wish on the devil himself. I remember one time driving home from work, it felt like there was a fire. I know that all you guys out there have had heartburn before, but this was like battery acid and fire combined. I remember taking a bottle of Maalox and I was drinking it to try to find some relief. Now, again, there's a situation where I had GERD. It was probably irritated from the extra acid, again, from the hypersensitive nervous system where, you're in the fight or flight mode. So, everything is causing angst and upset. But I think the reason why I felt the symptoms so intensely was because of that. I do think that, I had really bad heartburn, really bad GERD, but I don't think that I would have felt it the same way had my nervous system not been in fight or flight mode. Let's see. Also, temperature regulation. I would feel like I was freezing, like you would, like when you have a fever, right? When you're getting a fever, a fever's coming on, I would have the body aches and everything. I'd take my temperature. It was always frustrating because for whatever reason, my temperature always reads low, always has. And I'd feel like this. I'd take my temperature, 96.4 or something under my arm, something ridiculous where I know that I do not have a fever. And I'm wondering, why do I feel this way? Well, fight or flight, adrenaline dumping. A lot of the times, remember, your body's trying to keep you alive. So what it'll do is it'll send all the blood to the organs that keep you alive, your brain, your heart, your digestive organs. That's where it's going to send all the blood. So guess what? Your extremities and stuff, you're going to get cold. This is something that happens. And when it's turned on all the time, your body, you're going to have an awful time regulating your temperature. And, this seems like a small thing, but it's not a small thing when you have generalized anxiety disorder or panic disorder. and you're starting to pay attention to all these physiological symptoms that seem quite intense and very different from anything you've had prior to that. Yes, I had experienced dizziness. Yes, occasionally maybe a little shortness of breath, maybe some heartburn. Nothing like what I felt in the summer of '03. That was 10 times anything I'd ever felt. So, this makes you feel like there's something physical going on here. I mean, at that time, I had 31 years on this earth, and I never had felt anything like this. And it's weird, even though you know that your stress is high, you're not equating how elevated your stress is with these symptoms that you're having, because again, the symptoms are physiological. Let's see. I also had body-wide muscle twitches and tension. So these were, I've also made videos about the fact that I assume, because I've had no loss of function or loss of strength, that I have benign fasciculation syndrome. But when in '03 and other times when I've had relapses and my anxiety's been really high, I would wonder why my muscles would be sore, and why muscles would twitch all the time. I mean, just constantly, and from head to toe. I mean, scalp twitches, guys. I don't know if you've ever had scalp twitches, but that's pretty bad. The thing that was also unnerving about these symptoms is how they would last 24 hours a day. And, normally if you have something, a symptom like, say you get a fever, or, when the fever's coming on, you get really bad body aches, but then, maybe you take some Tylenol or Advil or whatever you take, and the fever breaks and you get some relief, right? But with these symptoms, I wasn't getting relief from any of them. And it was, it was really scary. So now you're saying, now how does this turn into health anxiety? Well, again, the symptoms are all physical. This is not, oh, I feel nervous, or, this is, I had irritable bowel syndrome as well. And, all of these symptoms were physical. So you start wondering what's going on. And then your mind starts to work in conjunction with your hypersensitive nervous system. And that's where that cycle of health anxiety starts. And it is horrible, because then all of a sudden you're going to start paying attention to everything. Pains in your head. We get shooting pains in our body all the time. We don't pay any attention to it. But if you're fight or flight, and then you start thinking about it and developing these negative thought patterns of catastrophizing and worst case scenarios. So now all of a sudden, oh, I have a headache. Oh, it's a brain tumor. Oh, I have dizziness too. So there's two symptoms of a brain tumor: headache and dizziness. Oh, another symptom I had, guys, was to do with my vision. And so now imagine if you have all three of those. My vision would get blurry sometimes. Also, I would have black spots in my vision. It was really strange. But these things all start to feed each other. So, and I wonder how many people have had this exact same thing happen. Maybe they have a small underlying health condition that maybe they've had their whole lives, or maybe it just came on, like me with my allergies, or maybe, as you get a little older, having some stomach issues. But if you're in that fight or flight state and your nervous system's hypersensitive, the symptoms are intensified, all of a sudden you're starting to think, okay, what's going on here? These are bad physical symptoms that I haven't had prior to this. Okay, so now the rest of the video, I'm just going to talk about a few things you can do to get yourself out of this terrible place. Because I'm telling you guys, if health anxiety starts to become an issue, it is insidious. It will lead you to Google searches. It will lead you down a rabbit hole that you don't want to go down. So the first thing you need to do if you have gotten to the point where you're having physical symptoms, go see your primary care doctor, get everything checked. Have him check everything. Have him or her check everything, especially if you can afford it. I know health insurance is ridiculous, at least in the United States. But if you can get checked out from head to toe. And this is for two reasons. For one thing, if you have a physiological health problem, you want to get it addressed. And that way that can get rid of whatever that symptom is, right? But just as important, if this is stemming from anxiety, if this has become like part of health anxiety, generalized anxiety, you need to know that that's what's causing it. So that is going to be an important part, an integral part of getting better from health anxiety, is accepting that it's anxiety causing those symptoms. So that's why you go see a regular doctor and get checked out, get everything that you're nervous about checked out. Whatever could be causing, because the common things that could cause similar symptoms, things like thyroid, being diabetic or pre-diabetic could cause some of these issues. There'll be a list of physiological health issues that mostly can be screened by a simple blood test, or if not that, maybe there might be some slightly more invasive procedures that you have to endure, but it's worth it to get to the bottom to make sure that there's nothing going on physically with you and that this is anxiety. Now, once you realize, okay, and this took me years to finally admit to the fact that these physical symptoms were being caused by anxiety, then you have to go see a mental health professional. And this is going to take probably the combination of cognitive behavioral therapy as well as medication. Now, you might not need medication. There's a chance of it. But if your nervous system is hypersensitive, the only thing that got my nervous system to stop being that way was medication. I took a combination of a slow-acting benzodiazepine and an SSRI that I still take today. And this took me from having my hair would stand up 24 hours a day. If you guys, you watch a scary movie or something startles you and your hair stands up, well, that was literally 24 hours a day for me. So when I started taking, about 6 weeks after I started taking a combination of these medications, that's when that started to stop. And I noticed all of the other symptoms that were so pronounced before: shortness of breath, dizziness, all of those things, vision issues, the being cold all the time. All of these things started to get a lot better. And, it does take time. That's one thing I want to let you guys know. Once your nervous system gets to that point, because you've just been stuck in fight or flight, it's going to take a while. It could take weeks. It could take months. And then you're also going to have to work, because what will happen is you've learned to pay attention to things that you shouldn't pay attention to. And you've also learned things like catastrophizing and going worst case scenario with everything. So because of that, that's why you need the cognitive behavioral therapy. And you're going to have to talk yourself through some of this stuff. As far as, what I always like to do, I like to label things. If I'm starting to have my hair starting to stand up, that'll still happen to this day. I tell myself right away, that's anxiety. That's not really anything else that can be. So I tell myself that's anxiety. So you want to label it. And, I'm not going to get into exactly how cognitive behavioral therapy works, but it's going to be, you know, it's going to involve labeling things and recognizing and telling yourself that things are anxiety and that there's no reason to hyper focus or obsess or, you know, get stuck in a vicious cycle of worry, research, and symptoms. And then another thing that you'll want to do is, and I've talked about this in all my videos, and this is how you go with panic attacks, physical symptoms from anxiety, intrusive thought, OCD. This is really hard to do, guys, but it's so important with all of these anxiety spectrum conditions. You got to let it happen. So if you are having physical symptoms like dizziness or, you know, issues with, you just got to kind of let it happen and try not to react to it. It's not going to be instant where, oh, the physical symptoms went away because I ignored them. That's not how it works. Like I said, you're probably going to have to see a mental health professional, and you're going to have to, you might definitely have to take medication. It's definitely a possibility. But you definitely want to not overreact to things. Let them happen. If you're having a panic attack, let the panic attack happen. If you're having intrusive thoughts, just let them play. Try not to pay attention. Just allowing these things to happen and not really dignifying them with an emotional response, especially a hysterical response. It's extremely difficult. It's extremely difficult, but it is the only way to get better. At least that's been my experience in these last 21 years from these anxiety spectrum mental health conditions. And one more little trick I'll mention before I end the video. If you're having multiple symptoms, let's say, you know, you're focused on the pain in the left side of your head. That's another symptom that I've had over the years. You can, maybe you're also having, let's say, dizziness. Well, pick one of them and focus on it and see what happens to the other symptom. If the other symptom lessens or goes away completely, the reason why I do this is because it proves to me that it's anxiety. Because if you're having a physiological health issue, you know, you break your leg, the pain doesn't go away because you think about your, you know, a hangnail on your pinky. And I mean, yes, to a certain degree, we really can only focus maybe on one thing at a time, but it'll still be there. You know, if you get the flu, you're going to have, you know, all of the pleasant symptoms simultaneously. But if you have health anxiety as a result of a hypersensitive nervous system, when you start to focus on one, go ahead and watch and see what happens to the other ones. And that'll tell you a lot. And that's important because the hardest thing for me to do, guys, was to admit that anxiety, that fight or flight chemicals could cause the physical symptoms I was having. I was incredulous. I'm like, I've been here 31 years. So all of a sudden, you know, now I have a little too much adrenaline and something's misfiring in my brain. And all of a sudden I feel like I'm having all these horrible physical symptoms. Yep. That's what happens when the fight or flight, when you're stuck in the fight or flight state for a long period of time. And it's horribly unpleasant. It's really scary. But the good thing about it, as opposed to those physical symptoms that you may have from an actual physiological health problem, you can get better from these and they're not going to kill you. None of these symptoms are going to kill you. As unpleasant as they feel and are to experience, they're not going to lead to your demise. And I wanted to make this video because, again, I talk all the time on my videos about wasting time. A lot of the time I wasted over the 6 years before I was successfully treated was wasted on health anxiety. And it's insidious enough where I would be lying to you guys if during my 2 relapses in 18 and 20, if I said that I didn't also develop health anxiety again during especially the one in 2020. So even when you know what it is and you've taken medication and you've been experiencing it for, the better part of 20 years at that point, it's insidious enough where if you don't go through these steps and reason it out in your mind, you'll end up in a bad place again. And that's just from personal experience. So anyways, thank you guys so much for all the engagement with the channel. The comments, I so greatly appreciate it. Like, share, subscribe. If you know anybody who's going through any of the anxiety spectrum disorders, you notice that they're clinically depressed or they seem really down, or you can tell something's not right and they're anxious all the time, recommend the channel. Have them take a look at some of those videos. It's really helpful when you think, because I felt like I was losing my mind a lot more than once. But to see someone else have the same symptoms, go through the same thing, and you realize that, okay, so it helps you identify what it is. I also talk about how you guys can get better from these things, and it's going to be really beneficial for someone to know that they're not alone. So anyways, thank you so much, and until my next video, take care.